A very good afternoon to one and all. The topic for today is more of an awareness initiative. It's a topic about the field of pain medicine. I'm Dr. Khaja Javed, consultant pain and palliative care physician. So I will be taking you through this webinar, trying to highlight on certain aspects of the field of pain medicine, certain unknown aspects which will be new, and we will be focusing on them. So moving ahead, let's try to understand what is pain medicine, right? So it's a relatively newer term, and a lot of us haven't heard of this term. So let's see what it is. So pain medicine is basically a super specialty branch of medicine. And when I talk of super specialty branches of medicine, then one thing which we need to keep in mind is there is specialty, a broad specialty, and then a super specialty. So pain medicine is a part of anesthesiology, and it is a subspecialty or super specialty after doing anesthesiology. And if you look at the term super specialty, then quite a number of branches come to your mind. For example, you would have heard of something called cardiology. Now, anyone having a heart-related problem will first go and visit a cardiologist, right? And similarly, if anyone has a brain-related problem, they meet a neurologist. Kidney-related problems to urologist, and vice versa. So similarly, pain medicine is also a branch of medicine like this. So wherein patients suffering from severe chronic pains, they consult a pain management specialist. Now, did you know pain medicine is also a super specialty branch of medicine? And importantly, it's a branch which deals with catering to patients who have been suffering for a long time with chronic pain, wherein the regular treatments, regular medications have not given the desired pain relief. As a matter of fact, many doctors themselves are not aware that there exists a branch of pain medicine. So let's try to understand what, as pain management specialists, we do. Simply speaking, we stop the pain. Now, any kind of pains it can be. For example, someone is suffering from severe headache, which is not coming down with the regular paracetamols or the dolo tablets, etc. Then you need to visit a pain management specialist who will take a detailed history, reach to the diagnosis and the cause, and treat the cause accordingly so that your headache comes down. So tablets are not the only thing which are there in the domain of a pain management specialist. There are other interventional techniques as well which help to take care of the pains. For example, BOTOX injection. For headache, now BOTOX injection is US FDA approved treatment, and a lot of chronic sufferers from migraine especially, they benefit a lot from the BOTOX treatments. Let's move ahead to a bit lower to the neck region. A lot of the people have been suffering from neck pain, especially with the work from home culture coming in. A lot of people spend quite a number of hours in front of the laptop and end up developing these pains. Not only those sitting in front of the laptop, even people who use the mobile phone for a long period of time, they also can develop this neck pain, because most of them are in a neck flexed posture when they are seeing their respective mobile phones, resulting in stiffness and pain around the neck, usually due to spasm of the muscles. So whenever muscle goes into a spasm or muscle becomes tight, then what happens inside is there is a formation of a knot. These knots are referred to as trigger points, and they can be the source of pain. So usually, how are these treated? Either with medicines, muscle relaxants, painkillers, analgesics, physiotherapy, etc. If not coming down, then we do something called as a trigger point intervention. What is a trigger point intervention or an injection? We are going to identify the muscle which is having the trigger points, use an ultrasound, visualize the trigger points, and reach that target and inject some amount of local anesthetic. What this is going to do, it is going to dissolve or break the knot, thereby giving the patient good pain relief. Moving ahead to back pain, as per a survey, most of the patients who come to the OPDs worldwide suffer from back pains. So you can understand back pain, how common it is. So it becomes very important and imperative for us to take right action whenever we get back pain to see that it doesn't become chronic, right? So also many of you would have heard of the term sciatica, an electric shock like burning pain going all the way down from the back, lower down till the leg due to irritation of the sciatic nerve. So what we need to understand over here is the spine or the backbone is a very important component of the body. I usually tell my patients coming with low back pain that back pain is like opening a Pandora's box. You don't know what the causes are and everything. And importantly, what we need to keep in mind is treating the cause is very, very vital to get rid of the back pain. So we do something called a spine interventions. Now, as I was talking to you, the back is a Pandora's box. So we need to identify the cause. See, there can be a lot of causes for back pain. It could be a slip disc, could be a facet involvement, could be a muscle spasm again, could be arthritis, etc. So if you know the cause, then you can accordingly treat it. So spine injection is a procedure wherein usually, for example, if someone is having a slip disc, then the nerves which are coming down from the spinal cord, they end up getting irritated. So we reduce the irritation or the inflammation of these nerves with the help of the spine injections. All the procedures are done using X-ray guidance, fluoroscopy guidance. Let's move ahead. Shoulder pain, again a very common entity, very common problem with which patients come and visit us. So one thing which most of you would have heard is something called as a frozen shoulder, right? So what is a frozen shoulder? Many of our time patients can develop a bit of pain in the shoulder and restriction of movement of the shoulder joint as well. So this is very commonly seen in diabetics. So especially when they want to do their day-to-day activities like moving around, using their shoulder, the arm, the movements, they all end up being stiff and in pain. So that is what is frozen shoulder, right? So like this, for example, this patient had come to me with the frozen shoulder. As you are seeing, left side hand is able to lift up fully, but right side is only able to lift half. Okay. So as you are seeing over here the patient was not able to lift, but here if you see, the movement has almost come back. The pain has relieved and the shoulder movement has improved compared to before, right? So how did this happen? How did this happen? Was it magic? No, it was not magic. So we did a shoulder joint intervention using an ultrasound wherein we localized the problem, the capsulitis, and treated the cause, and the patient ended up having good benefit. Moving next, knee pain. Again, anyone above 40, 50 years, most of the people would have experienced knee pain one time or the other in their entire lifetime. So osteoarthritis is one very important cause of knee pain. So if you see what actually happens in osteoarthritis is there is a loss of the cartilage, there is joint space narrowing, which leads to these problems. We're seeing an X-ray of the knee joint. This is a normal, and on the left and on the right, you're seeing a loss of joint space due to degeneration of the cartilage. What are the treatment options? There's medicine, physiotherapy, total knee replacement, or surgery. Is that it? What for patients who don't want to undergo surgery? We have a few options. One of them is regenerative medicine. We use something called as platelet-rich plasma drawn from the patient's own blood. It has platelets are a storehouse of growth factors, right? So once they are injected inside the knee joint, the cartilage, they go and start the healing process. Other treatment is something called as radiofrequency ablation, preferred in patients with severe osteoarthritis when no cartilage is left, who have to undergo the surgery, but due to certain reasons cannot undergo surgery. So for them, instead of leaving them suffering in pain, we do something called radiofrequency ablation, wherein we target the painful nerves around the knee joint and we're going to block them. Moving ahead to foot and Ankle pain, again, a very common entity. So diabetic neuropathy is one very important cause, wherein there is pins and needle, tingling, numbness around the foot and ankle, and the patients characteristically tell that the foot becomes heavy. It seems like they're walking on sand, right? So what we need to know is very important and how to take care whenever there's diabetic neuropathy, right? A regular foot care is very important. Clean and wash and moisturize your feet regularly. Perform a daily foot self-examination, because remember, in diabetes, the sensations are decreased. So many of the time, the cuts, swelling, blisters, you may not be able to appreciate unless you take a keen look. Check for shoes, wear appropriate fitting and comfortable shoes. Moving ahead to cancer pain, another very huge entity or component of pain. It's a part of palliative care, actually, mainly. But cancer patients also suffer from pain. But there is hope now, definitely. With the various pain management techniques, we can reduce the pain of this patient, reduce the suffering. Morphine is one such medication which is given orally in cancer patients to help decrease the pain. Something called intrathecal pump as well, which is implanted inside the skin, and it is having a catheter inserted into the spinal column. So what does it do actually? See, whenever you take a medication, a tablet, see, it has to go through your mouth, going down all the way to your digestive system, and then get absorbed, and then the effect is going to come. So ends up in a lot of side effects, right? So by intrathecal pump, we can directly deliver the drug to the nerves, wherein we are bypassing all this, and then the side effects are also bypassed, and the dose also gets reduced almost to 1/10 or 1/100th of the respective drug. So let's move ahead to palliative care. What is palliative care? Palliative care is symptom management of a chronic or life-limiting illness. Here, we have realized that there is an illness which may or may not be cured. So what we're doing over here is trying to reduce the suffering of the patient. What is hospice care? It's providing comfort care at the end of life. So what is end of life care? Managing symptoms, the patient's wishes, spiritual well-being, breaking bad news, legal issues after death, emotional support, continuing care, patient and family. These are all components of end of life care. Right, so let's have a look of pain medicine across the globe. If you see, I mean, most of the places, pain medicine originated in the West, actually, US and America, and then it is, I mean, now spread wide and fast all throughout the globe, and most of the patients now, even in India, the awareness is increasing. We are all making our efforts so that most of the people who are there, they get access to pain management services. Let's have a look at a certain advanced intervention which are done in pain medicine. One is called endoscopic discectomy. So this is something like a slip disc, wherein initially only operation was the solution. So this is again operation only, but a keyhole operation. Something like initially gallbladder removal was done by open technique, but now lap technique is done. So somewhat in similar lines. Something called biacoplasty as well. Again, this is for discogenic low back pains. For all chronic pains who have no answers to any treatment, medications, or interventions, spinal cord stimulator is the last resort, which can be done. So what are the advantages of the pain management interventions? Daycare, right? No need for hospital admission. Patients can return to work as quickly as possible. No surgery over here. Everything is done by experts under vision, and that is image guidance, and everything is done under local anesthesia. It's a simple trick for the patient, but technically challenging for the doctor. So to conclude, I would tell that the term that I have to bear with the pain is totally wrong. Pain is something which needs to be taken care of. And for that, it is very important for you to visit the right portal, visit the right physician for taking care of your pains. And remember, awareness is the greatest agent for change. Increasing more and more awareness about pain medicine and pain management, the ability to access to all the services of pain medicine is what is the need of the hour. Thank you very much for your patient hearing. Are there any questions? Thank you very much.
Thank you, Dr.